I'm Martin Todd, Chief Executive of the Men's Health Forum. As you might guess from the name, our focus is the health of men and boys, physical and mental health, right across Great Britain. In order to try and influence it, we bring together researchers and carry out research. We work to share good practice, we work to raise awareness, and we provide health information and advice to men and for people who work with men through our website, Men's Health Week, and our man manuals. This year, with the COVID pandemic, our work has never been more needed. Right from the beginning, as we looked at how the disease had started in China and what we were seeing in Italy, it looked likely that men were going to be disproportionately affected. Even though it took the government ages to start producing decent data broken down by sex, as early figures came out from other sources such as NHS staff illness, intensive care statistics, it became clear that at any given age, men were twice as likely to die from COVID as women. That the jobs that men do were particularly, or that some men do, were particularly high risk, and that men were behaving differently in their response to COVID to women, and that some groups of men, particularly BAME men, men in areas of deprivation, were especially hard hit. And so we got to work. We lobbied government and policymakers for better action. We pulled together experts in webinars to discuss the challenge. We turned over Men's Health Week completely to men and COVID, and we produced straightforward information for men on COVID and how they can protect themselves and those close to them. And we continue to share relevant new information via our website as it comes in and via our email. And our job isn't done. As we look to the future and, for example, the likely upcoming vaccination programme, we're going to need to confront further challenges. Vaccines often work less well amongst men. Working age men are less likely to go for vaccinations, at least that's what happens with flu vaccination. And the reasons that men don't get vaccinated are often very different from those of women. And it's already clear that the government isn't even close to doing enough to recognise this. So we really appreciate being shortlisted for this award for what we've done so far. But there's still an awful amount to do. So whatever happens in the rest of this evening, anything you can do to support us on COVID and our other work from here on in will be greatly appreciated. Thank you very much indeed for deciding to shortlist us. And whatever happens, I hope you can continue to support us in the future.